As Oklahoma sets new COVID records, government officials and the medical community are pleading for the public to take proper precautions to mitigate the spread. But don't expect a mask mandate from the governor anytime soon.
As far as a mandate, I've been very clear that I don't think that's the right thing to do. This is a personal responsibility. This is pleading with people to do the right thing.
Just days after Oklahoma set a record one-day total for new COVID-19 cases and hospitalizations, Governor Stitt gathered with healthcare professionals to plead with the public to redouble their efforts to slow the spread of the virus in our communities, even as calls for a statewide mask mandate increase on the national and state levels.
The House Democratic Caucus would also like to take the opportunity to strongly reiterate our call for a statewide mask order, either from Governor Stitt or from legislative leaders during a special session.
House Minority Leader Emily Virgin believes the numbers should spur the governor to act.
When we see each day's numbers increasing, I want to remind Oklahomans, the governor, my legislative colleagues, that these are not just numbers. These are Oklahomans who are suffering.
As the numbers surge upward in Oklahoma, hospital capacity is tightening. Tulsa's ICU capacity hit its limit last weekend. Mayor G.T. Bynum feels Tulsa is left on an island with its own mask mandate, while surrounding communities in northeast Oklahoma do not.
And yet, where the issue is, where 61.4% of hospitalized patients are, is not in our jurisdiction and is not in an area where we can impact. And yet, in the places where we need that help, it's not coming yet.
He adds people trying to get treatment might be turned away if their symptoms are not severe enough.
That's the threshold that our community is facing right now as far as the capacity for our hospitals to be able to treat people. Your respiratory function has to be in danger of collapse. Less than that, discomfort, agony, you have to go home and treat it yourself.
State Health Commissioner Dr. Lance Fry says a coordinated effort to direct patients to where they can get treatment is underway.
Hospital capacity is always a concern and something we are monitoring daily. We are aware of the impact currently going on in Tulsa and are working with local leaders and hospital coalitions in both metro areas to ensure every Oklahoman who needs a hospital will have a bed.
The increased number of COVID patients in ICU beds means Oklahomans should expect the death rate to increase as well.
We've had consistently more than 300 Oklahomans in the hospital in the intensive care unit. So because of that, we know that the mortality rate from COVID-19, particularly when you're sick enough to be hospitalized and in an ICU, is very high, and that we're going to see more deaths in our state.
The Institute for Health Metrics and Evaluation echoes Bratzler's analysis of the most recent data.
Several weeks ago, they had predicted that Oklahoma would have up to 1,450 deaths by Thanksgiving. We're going to have that many deaths by next week, and in fact, if you look at their most recent projections, they're projecting that there'll be 1,795 deaths in Oklahoma by Thanksgiving Day.
We're also recommending all college students get COVID testing before they return home for the holidays and leave campus for Thanksgiving.
Remember, you can spread the virus to someone even though you don't have symptoms. It's a natural reaction to let our guard down when we're around our families. But as we enter the holiday season with our family, friends, and neighbors, please be careful.
There are plans to expand bed space if needed, but hospitals also need the nurses and doctors to treat the patients.
Beds, however, are not enough. Staffing is becoming an issue. Nursing, respiratory therapy, physicians. Hospitals in the region are actively looking at nursing ratios together and ensuring patient transfers occur with these coordinated numbers in mind.
We've instructed the nursing board to clear any red tape, to allow nursing students and nurses who are licensed in other states to practice in the state of Oklahoma.
While a statewide mask mandate is not likely coming anytime soon in Oklahoma, the healthcare community says the science shows masks work to mitigate the spread.
Since August 1st, cities whose residents are wearing masks saw a 21% rise in cases, compared to an 88% increase in cities where residents aren't wearing masks. And it's also not about a mandate. The governor nor the government should have to tell us to do the right thing.